It's really important to understand why people don't vaccinate. We can't keep second guessing the public and imagining why they're not vaccinating. We've got to ask them. And that'll help us fine tune the best solutions to this problem. And here's the problem. So for the black line you see here, and this is from 2020 to 2024, these are the 65-year and older age group, national data from the National Centre for Immunisation Research, showing 62% of people had a flu vaccine by the end of the flu season in 2024, and that had declined since 2022. For children, that's another important group. So that's the 6-month to 5-year-olds who are also have the vaccine recommended and it is free for them. That group have a coverage rate of 28%. So our influenza vaccination rates in Australia are dire and they're not improving.
Some countries in the Northern Hemisphere had a severe 2024-2025 influenza season, for example, the US, although others, for example, China, did not. In Australia, we've seen increased influenza activity in all jurisdictions in early 2025 when compared to previous years. Despite the increased influenza activity, we can't currently predict the severity of the upcoming season in Australia. This will be dependent on a range of factors, which virus subtype becomes dominant or which strain becomes dominant, for example. Influenza vaccines are now available and are the best way to reduce the likelihood of hospitalisation and GP visits associated with influenza infections. And finally, some avian viruses continue to cause occasional infections in humans, but there is no evidence of human-to-human spread. In an unpredictable kind of seasonality that has a few quirks about when it kicks off, I think this unusual activity is related to behaviours rather than viruses emerging.